Okay, good, it's showing it. Kim, can you hear us? I couldn't hear you, but you can hear us?
Yes, I can.
And we can hear you too. Thank you. No, that is not right.
Is it Google Meet something?
Yeah, it's supposed to be Teams. Hey, okay, here's the chat. Okay, so it shows from previous meetings also. So you don't have to worry about that, but you can see this is the beginning of the people are chat.
Gotcha.
And then I think I can let people in, so that way you can just stay on the chat.
Like if I didn't have to, they have computers. This is why I go to work. I don't leave back home.
Morning. Good morning.
Good morning.
Fascinating. How about you?
Automatically tell you that probably.
At the finish line, or are you staring down this week?
I'm staring down. I graduated
Oh,
on Friday.
okay, you can say thanks for letting us know.
Crazy. I like got home on Monday. I finished one
She was
today. I got home yesterday and I was like, what do we do? So like, I was asking my I was like, do you need help with dinner? He was like, no. Go to the down.
Taking it easy is one of the hardest assignments to do. I just do.
No, not from local public health. Usually we have more.
Did you see that the coastal family clinic, they were doing a job fair
Yes.
coming up?
No.
Pull up the dates, but
No, Stefan.
they're doing a job fair.
I'm here.
Yeah,
I wanna work, so.
you are Stephanie today.
All right.
That's fine. Okay.
Thank you for telling on it here. Good morning. Yeah. First and then. Good job. The kids are back.
19th,
You could
2:30 to
tell them
5:30.
back. Works for her.
Oh, just shows up.
Oh,
Okay, for some.
oh, weird.
One of the few people.
Oh, I wonder what's doing that for you.
Yeah.
I should have been kids, so I do. But
Yeah.
I'm like,
Oh, it is already 9:31. I feel like I should wait a few more minutes.
The traffic wasn't so bad.
no.
Yeah, yeah, usually there's more people, but there's lots of people online. So maybe it's just that,
It was a little bit dark today, so they're like, we don't want to get.
Yeah. well, and like someone else pointed out online, it's the beginning of the
Yeah.
school year, so colds are going around, so maybe they're just trying.
Oh,
not to-
yeah. We're already a couple of those. Dr. Duncan, how was your event?
It was great.
I missed it.
You missed, I know you were
I
stuck
know.
in traffic or something.
No, I was just stuck in a meeting. That was my traffic.
Well, I had the best tamales I've ever had.
Nice.
So I don't know who made them, but they're very.
Montalban.
Oh, Montel, oh, no wonder you.
Who did them?
Montalban, Sara, Maya.
Yeah.
So they were Oaxacan.
You were good.
Nice. Oh, good.
It was fun.
That's awesome. Sorry I missed it.
I think we should have more events like that.
I know.
Big deal.
Well, you deserve it, sorry.
Yeah. You enjoying being with the,
Yeah, it's a tough year to be back there, but it's good.
Yeah, that's why I waited a few more minutes. Figured like maybe some people were rolling in a little
Oh, we
late.
have seen more activity. They're not doing any raids, but they are.
they're just around, it's friendly people.
They've been, no, and I think it's just specific people to come pick. But yeah, they're around.
I remember when I worked for the police department, they were always kind of around, but yeah, it was specific people.
Yeah.
Like that was like 8 years ago or something.
Specific people.
Yeah. That they have,
Just as a
that they have a
dispatcher training.
but they are trying to use their administrative.
This is a little too approachable for that.
Do it in that education.
No, I was dispatcher in a lot.
So,
too.
yeah,
I
they
love that.
feel- I'm both.
Maybe there's some of it, it's a lot of it's really permanent. They invade that monster Hyundai factory.
Oh, God, yes, all those poor Korean people.
Who knows whether they had warrants or not, but
Most of them had, they were in legal status, they were in the
Their
process.
visas.
Yeah, it was either asylum or refugees and they had the paperwork. That is not being respected right now.
Next week, Customs and Border Patrol will be in the community because we have, cruise ships beginning to come back.
Oh, okay. So, yeah, it's just looking for those colors. It's like, oh, this is the green one. Oh, no, that's the sheriff, sorry. I told Matt the other day, it's really mad. You didn't have any other color to pick for your trucks and green, just like I, so it's funny. But, yeah, no, they are around and on unmarked cars. They are unmarked. Yeah, it's just, they'll be taxing. I have to have that phone always in my hand, so I was like, bing, okay, I'll be back. Gotta go take a drive and try to find them.
do you think besides these big events?
It's 9:35, so I think I'm gonna start, but we can continue talking about this later
Yeah,
in
of
the,
course.
in the meeting. Thank you so much for coming today, people who are online and in person. So just for the little beginning setup, I am Lisa Schuyler. I'm the co-facilitator for this meeting. I work for Clatsop County Public Health. My other facilitator, Kayla Warner, who is with OHSU. She's not here today, but I do have Sarah with me. She's a public health volunteer and you're a student at Portland State University. Yeah. And so I'm really glad that she's here helping me. We have new computers, and so that part did not work out for her. But she's going to be monitoring the chat for me on our work phone. So if you do see someone with their hand up, or you see that someone said something in the chat and we didn't notice it because it's kind of hard to see on a phone, or we're trying to do multiple things, then please speak up because I want to make sure that people online are also included. And sometimes that's hard. In a hybrid. And then the bathrooms, if you're on your way out, the main hallway opposite kind of that welcome table, there's a hallway on the left that has the bathrooms. Parking, if you parked in the main parking lot today, that's fine, but they do prefer for our meeting, since there's quite a few of us, if we park in that parking lot across the road. And so if you come next month, just try and park over a little bit further out. Probably not as much of an issue going into winter now for them. But yeah, so let's go around and do introductions.
Me first.
Sure.
I'm Sarah. This is my first time being here. I'm excited to be here, and I'm a student at Portland State. Like Lisa said, I'm studying social work. So I'm hoping this will be a rather informative and learning experience for me.
Welcome.
Thank you.
I'm Norma Hernandez. I'm the Deputy Director of Consejo Hispano.
My name is Emily Riley. I work for Oregon State Extension Office as a Health Extension Program Coordinator for Clatsop, Columbia, and Portland Metro.
Tom Duncan, Clatsop County Health Officer, Clatsop County Health Department.
And good morning, Tom Jenkins with the Oregon Department of Emergency Management. I'm a regional coordinator out here, and Clatsop County is one of the 4 county jurisdictions that I support. And I'm also a Portland State alumni, class of 2023.
Sarah Farmer, also Sarah. I'm the Community Engagement Coordinator for 211 Info, and I cover Columbia and
My name is Sam Jeans. I work with Clatsop Community Action with the Veterans Service Office.
I'm Jackie. I don't represent anyone. I will be graduating from nursing school on Friday at OHSU. I've been helping with a variety of groups here. So also volunteering with public health, helping stand up the Clatsop County COAD, so the Community Organizations Active in Disaster. I will be working with Jess Lassio on the campaign to maintain fluoridation in Warrenton, and hopefully finding a job at some point.
Busy person.
Yeah.
Congratulations.
Thank you.
Yeah, exciting.
Thank you.
I'm Kestrel Gates, she, her pronouns. I have the Building Us Postpartum Navigator pilot project, soon to be parent map. And
Awesome. So going online, I see Kim, you are at the top of my screen. So do you mind going first?
Nope, my name is Kim Bissay and I'm with the CPCCO in Clatsop County.
Thank you. And then I have Tom next on my screen.
Hello, everyone. My name is Tom Elston, he, him pronouns. I am with the Oregon Family Support Network, and I'm as sick as a dog, but here online with you all. So,
Well, we're glad to have you virtually where you can participate with everything but your cooties. Tracy?
Tracy Villarreal, Providence Seaside Hospital.
Thank you, Tracy. Ariel?
Good morning, everyone. I'm Ariel Salgado, she, her, ella. I'm the Outreach and Education Coordinator for the Oregon Health Insurance Marketplace in Clatsop County.
Thank you. Rachel?
I'm Rachel Parker with Northwest Parenting at the Northwest Regional ESD.
And Meredith?
Meredith's camera or microphone.
Oh, okay. Meredith Payton works as a social worker at Astoria High School and also at Clatsop Community College, both places. So, writing her name down. So we're glad that you guys are here with us today. I'm going to try to share my screen. Last time this was very complicated, but this time I'm not sharing any audio, so hopefully it will be easier. To go back to the window where you're sharing to resume. Aha, okay, yay, worked. Okay. So for today, it was proposed at the last meeting that we talk about the positive culture framework a little bit more. It's okay if you weren't at the last meeting, but we watched a couple of videos from the people who created it at University of Montana or Montana State University. And then we watched the videos, we talked about the framework. We've broken into groups and we kind of talked about how to use the framework a little bit, but it sounded like people wanted to kind of understand how to use the appreciative lens and how to kind of apply this to their work a little bit more. I was hoping to have time to like send out and get a feel from everybody on like what topic they would want. I ran out of time on that. So I just decided to use where you guys had decided to sit the most at the last one. And then the most people decided to sit at the tobacco area. And so this month, you guys each have a packet that has some information on perinatal nicotine tobacco use with a little bit of statistics and kind of some overview. And I'll get into that later. I'll give you like a short little overview of the positive culture framework so that if you weren't here last time, you still understand what we're talking about and can start to think about it. It is a pretty kind of extensive framework that includes coalition building. And so like, obviously we're not going to solve the issue of perinatal tobacco use today and be forming a new coalition focused on perinatal tobacco use. But I think it is a good thing to be thinking about. And it's also a good example of how this can be used, but it doesn't, anything that's safety or health related is what you can use the positive culture framework for. So even though this example is very specific, I do think that it's something that you can use in all of our work. I can think of a lot of different, like, I mean, just looking at any one of you, I can think of ways that you could probably use this. So for today, we'll look at the framework, we'll look at some data, we'll do a group activity around the appreciative lens, and then another one on the social ecological model, and then kind of some final takeaways and some ideas of ways that we can use it in our work. And then we'll move into doing our regular group updates, which hopefully we'll have some too. Okay, so this is the positive culture framework. It's complicated looking, so I'm gonna break it down and start with just that blue ring around the outside. So this is kind of the coalition forming part of it. And this is kind of a chronological roadmap for how you would use it. So, you know, and this isn't really specific to this model. It's very similar to like the a strategic prevention framework and a lot of other coalition building frameworks that there are. So you plan and advocate, you assess, you know, you establish common purpose, you develop strategies, you pilot and refine, and then you implement, and then you evaluate, and then you kind of do it over again, which is why it's in a circle. It's like, this is just a constant process when you're working on an issue in a community. So in the middle of that circle, this is the social ecological model. So, so this is like the different levels of influence, basically, that people have on their lives and on their decision making and their behaviors. And so that goes everything from like the individual, which is like your personal attitudes and behavior, all the way up through like your family and your peers influence that, your schools and workplaces influence that, your community influences that. And then there's other models that also have like policy. So like policy also influences that, like the decisions on a bigger scale that government is making for you. So the skills that they think you should cultivate in order to do this work is leadership, communication, and integration. So communication, we talked about last time, that's like raising hope and concern, but not fear, because fear immobilizes you. Hope and concern motivates you to create change, behavior change. It should be 4 to 1. So the hope should be, and the action should be 4 times for every 1 time you raise concern. That's about the amount that they have. For leadership, it's really putting the appreciative lens into practice and modeling that. And then for integration, they're talking about that social ecological model. Don't just work on one of those circles, work across those circles, and your strategies are going to be more effective. So then over here, this is like the appreciative lens part. So this is kind of the content of what you're trying to do with all that other work. So you're trying to improve health or safety, you know, you have a specific thing, but focusing on what it is that's already in the community that you want to cultivate and use to grow and achieve your goal, as opposed to trying to impose something on the community or trying to focus on the thing that you want to eliminate. Because that's how you get kind of the motivation and the momentum behind a project, is capitalizing on what already exists and growing that in order to achieve your goal. So that is a very basic overview. Last time we kind of spent most of the time watching and learning more and learning vocabulary. So I'll just pause. I'll pause right here and just ask if anybody has any questions about some of the vocabulary that I used in this, or if there was anything that you were here last time and you noticed from the videos that you think was important to highlight that I might have missed right now for people who weren't here. Everything good? Does that all make sense? Okay. So let's just talk about some of the dangers of nicotine and tobacco use for the perinatal. So I broke it into during pregnancy and I broke it into during the child. And so that's kind of on the first handout, which is that handout is something I created for parents. And so, but it is, that's how I broke it up on that handout, is like thinking about what the effects are during your pregnancy and thinking about what the effects are on your child. So what do you guys think? And I do have the list, so it's fine if you aren't already experts in how tobacco affects people, but what do you guys think some of the effects of nicotine and tobacco might be on pregnancy?
Low birth weight.
Absolutely, yeah, it's a good one. Yeah, not a good one, but that's a true one, yeah.
Guessing maybe circulation issues, like heart problems.
Yeah, yeah, definitely. And I think one of the points that I had on there was like nervous system. And so I think that probably ties into that.
Like chronic illness risk.
Yeah.
Is there higher risk to mental health disorders?
So tobacco does definitely affect mental health. And so I don't know what the effect might be on the developing fetus or the baby after they're born, but definitely postpartum period when your mental health is so important, and tobacco and nicotine products can have a negative effect on your mental health. So, yeah.
Do you think babies withdraw from nicotine after birth?
That
Is that part
of
of irritability?
Babies can have withdrawals if the mother's actively using during pregnancy.
Yeah.
From nicotine?
My
And the withdrawal.
my cousin had that problem when she was born.
Who did?
My cousin, my older cousin, her mom was a heavy smoker. And when
Baby was irritable or what?
when she was born, they had to basically coach her through withdrawing off of nicotine, and she was, a newborn. So they had to like hook her up to some sort of medication.
Yeah.
But my nephew, my older sister, smokes, and they don't know for sure, but the doctors assume it's probably related to my sister smoking. But his eyeballs are not correctly shaped. Our eyeballs are supposed to be basketball shaped, and his are shaped like footballs.
Mm-hmm.
So he has some vision issues because of that.
I would think too, respiratory system distress, both for the mother, if that's present, and then translated down to the child, if they're having challenges with correct O2 ingestion, and then if they're newborns and then around it. I wonder if that could also potentially induce some allergic sensitivities.
Yeah, definitely. So for pregnancy, we said miscarriage, preterm birth, damage to fetus, brain, and lungs, low birth weight, and increased chance of health problems after birth. But like, there's also a whole host of things for the mother, regardless of if she's pregnant or not pregnant, that smoking and nicotine use has a negative effect on. And that's going to affect the health of your pregnancy. And then also for the child, studies have shown that children who are around secondhand smoke or their parent use nicotine products during pregnancy are sick more often, breathing issues. Also, if you have nicotine products in your home, then there's a higher chance of nicotine poisoning for your child, because all of those vape liquids are toxic to children, and children have died from those. And then also being in an environment where there is nicotine use makes you more likely to use it yourself when you get older. So then looking at some of the data, this is a screenshot that is very tiny and probably very nice to read. So, but the colors all represent kind of different percentage of births to mothers who use tobacco during pregnancy by county. So the level that Clatsop County is in is like that third dot down, which is the 8.7 to 11.2, and it says we actually have 9.4%. And this was from 2020 to 2022. And so you can kind of see where we fall versus the other counties. There's some other counties that are in the same range as us that are in like Eastern Oregon. There's one in Southern Oregon. There's some that have that kind of purple color that are in Southern Oregon, Eastern Oregon, that are, between 11.2 and 14.7. So a little bit higher rates of smoking or tobacco use, I should say. And then there's some counties that are the light blue and the slightly darker blue that are have lower rates than us. And then the two counties that are white, that just means that they didn't have those were suppressed because they didn't have reliable data. So we're just not counting. We don't know if what their rates are. So what kind of strikes you about this data, if anything? I think I have more data that I can have us look at real quick before we talk.
So I was gonna say, it seems to be more rural areas, and that's my first impression.
Yeah.
Lack of resources, or maybe like prevention, education, or that kind of stuff.
Yeah, that makes sense.
Yeah, I was gonna say the opposite of that is the higher population densities, so you have lower rates.
Yeah.
Plus rural tends to mean poverty, more poverty,
Yeah.
which historically are the demographics targeted by
Yeah.
big tobacco.
You know so much about tobacco. I mean,
I have a lot of people in my family who smoke actually, or were smokers.
yeah.
So I am very much avoiding that.
Yeah.
So
Yeah.
Well, it's interesting too, looking at our counties that are on the Oregon coast. Southern coast and parts of the central coast have an extremely high percentage. The little strip of Lane County, of course, has to represent all of Lane County, but we're somewhat at a lower reported percentage for Tillamook and for Clatsop counties. And I wonder if there's some distinction between what we have available here versus what other similarly demographic communities are encountering or having reported to them.
Yeah. Yeah, that's a really good appreciative lens. You're like comparing us to people who are very similar to us. What is it that we're doing right now that we're not being as affected as some of our other kind of peers? Jackie, did you have something?
I was just curious if this is, do you know if this is capturing like, this is just tobacco use at any point during the pregnancy? This isn't.
It says births to mothers who use tobacco during pregnancy. So yeah, it would be, I guess, any point during pregnancy that a birthing parent said yes, that they were using tobacco.
I think it's interesting in rural communities how one program or even one service provider could totally impact the data.
That's
Or like,
exactly what I was
like if our health department was doing some tobacco education in those years, it could just be one person who's providing that information.
It's like that Wright County in the very bottom, like Josephine County is extremely rural, but someone is doing something.
It's like, could you capture even like, maybe you were smoking at the beginning when you didn't know you were pregnant, and then you go to your first prenatal visit, and then you learn that you're not supposed to, it's just.
You get the right kind of harm reduction support.
So it'd be interesting to sort of do the, like, actually go a level deeper and be like, okay, was this at the beginning? Were you smoking through the whole pregnancy? Did you stop after somebody told you, right? So it'd be interesting to see yes, I agree that little.
And I'm gonna be the devil's advocate. It could be that those go to the next county because they are surrounded by counties that are higher. It could be that they don't have really the services there. So it is reflecting in the neighboring counties, and that's why we don't see it there. They might not have the doctors, they might not have the care, there that it could be affecting the other counties when it could be that one, and it's just throwing it for
Yeah.
consideration,
Yeah.
not as a fact, but it is something that when you have it, you know, it's like how much care is there? It could be that they need to go to other ones and they don't capture.
And that totally happens a lot in rural counties. I'm realizing Columbia County has a huge difficulty with their data. Because, so if you're capturing it through county of residence, and it's like the state, you know, like Essence system, which is looking at emergency departments or hospital. I don't even know if it would capture this specifically, but then if you're doing it by county of residence, it's captured if it's in Oregon. But a lot of people go to Longview who live in Columbia County. So that information is just not captured. And then if it's doing it based on like location of where they're getting care, then that is in a rural place. That could be Portland. That's not, you know, Clatsop County necessarily. Like that.
Change of Providence, so they all.
Yeah,
All those people are gonna go.
Portland, or they are going, a lot of them are going to
Just
CMH.
CMH, but yeah.
Yeah, and
All Pacific County, also most of Pacific County comes to
Yeah.
Columbia
Mhm.
Memorial.
yeah, so Pacific County, it's like,
Yeah.
how are they getting any data on their residents when the hospital is located in a different state? So, yeah, that's definitely limitations potentially of this data. The other thing that I have that I think is interesting data, and so this starts in the left-hand column. It starts in 1993, and it's comparing the percentage of, it's cut off a little bit on there, percentage of births to parents who used tobacco during pregnancy. So it's kind of using the same standard, where we don't know whether they received any sort of cessation assistance and quit using tobacco at some point during their pregnancy. It's just a yes, did they use it? No, did they not? But you can see in the left column, it starts in 1993, and then it continues in the right column, starting with 2008 and going down to 2022. And it's comparing the US versus Oregon. And it starts at 15.8% for the US and 18.9% for Oregon in 1993. And then by 2022, it's down to 3% in the US and 3.5% in Oregon. And this is also from the same, it's from the National Center of Health Statistics, where the last graph was from as well.
So education is working.
So something, yes,
Something is working.
Yeah.
Well, and it's not just reflected for us locally in Oregon, but we're also seeing those numbers drop throughout the country. And so even as our population is a highly mobile and we have people coming to Oregon from elsewhere, they're seeing similar levels of education that are informing
Yeah.
their personal care.
Yeah. Yeah, totally, like nationally, like there's more understanding of the risks of using tobacco products. So something that strikes me about both of these is we're talking about tobacco, and that doesn't always include synthetic nicotine products. There's also not, because it's kind of emerging, there's not as much information on synthetic nicotine products, which is why I have like a little blurb at the bottom of that information that I give to parents that says like, there's not a lot of data around this, but that doesn't mean it's safe. It's still nicotine. You know, saying that tobacco does one thing to your body, but assuming that the nicotine by itself or synthetically derived is not also going to have a negative effect until we have more data is not a safe assumption to make as a pregnant person or as someone who's parenting. You don't want your child to be around that aerosol. So there's a potential limitation to this data also, that if they're talking about tobacco and they're not including synthetic nicotine, that some of those numbers that are falling could be, and I don't see like a dramatic all of a sudden reduction in 1 year. It's just kind of a gradual, but there is the potential that as people are using more synthetic nicotine products, that could falsely make some of the numbers look lower for tobacco if it's not including that. So that's something that I'm interested in for this data, which I don't have the answer to. These are all just questions. Just to think about.
So Lisa, for the same period of time, does the data go a little bit deeper to show the Clatsop County percentage for that period?
So I do not have it on a Clatsop County level. I think in the data that are in the packets that I gave you guys, in addition to this handout and the handout that I made for parents, There's also one that's from the PRAM study, which is a national one, and that's talking about I think that's in Oregon also, but it goes a little deeper of what you were talking about, like were they offered cessation services? It answers that question of what percentage of people were offered cessation services during their pregnancy. And I think that's just for, of course, I didn't grab one of my own packets, but I think that's for Oregon as a whole as well. But then I also have the data sheet for Clatsop County on tobacco use in general. That one doesn't specifically call out pregnant people in it, but it is kind of a little snapshot of our county with tobacco advertising and I should say nicotine advertising and use. So those are some other things that we could consider too. I'm not going to dive into those right this second, but I'm going to go to the next slide. Oh. Okay, thanks for the discussion. Okay, it sounds like, yeah, it sounds like one of the people has to go, but he wanted to say, I can still hear my voice.
I tried to turn my voice off.
He also wanted to do a plug for Nurturing Fathers online free course that he's going to be facilitating coming September 17th and will run weekly through November 19th. And it's Tom. And so it has his email in here too, which I'll pop that back up on the screen at the end. Yeah, thanks for stopping in, Tom. Sorry you aren't feeling well. Okay, so now I just wanted to talk about the appreciative lens a little bit. Do you guys want to take a second to look at the data a little bit more and think about it before we dive into this question of like, what positive do you see in our local culture that we can grow? And I thought we could just like write some ideas down based on the data and the discussion that we just had. Or do you want to jump into the activity? Okay, does anybody want to be a scribe? Because I'm left-handed and I don't like writing on boards and I want somebody to write on that arrow.
No, I was traumatized at the last Holomuck meeting. They were only made fun of my handwriting.
Oh, no. Oh, no. Well, I wrote, so I have another thing and I drew that wonderful lopsided circle over there and I rewrote it like 10 times because of my handwriting. So I feel for you. So thank you, Jackie. So based on that, on the data that we were looking at, and I think you guys already mentioned some things, I thought we could just kind of jot some of them down to start thinking about using this appreciative lens. What can we grow in our community? And it doesn't just have to be from the data. It can be from your personal experience working in the county, living in the county, whatever you guys pops into your mind.
Already like on here, the components, but I think of the smoke-free zones. Increasing those.
Yeah.
Something I smoke all the time.
Yeah.
I think connecting it to the non-public health aligned supporting initiatives. So I think of our reputation as, a corner of the Oregon coast where people from around the world want to come here.
Mm-hmm.
So people with all different values and experiences
Yeah.
are coming to our community and not having as much tobacco usage present helps improve the reception and the welcome that they have.
Yeah.
And this time of year, wildfire risk,
Mhm.
errant, neglectful use of tobacco products can be a public safety issue.
There's a whole campaign happening between the fire marshal and the tobacco prevention divisions at Oregon government right now. They have lots of materials. I should share some with you because I think it's a great campaign. Okay, I don't think that it's just occurring to me. Our next activity is more focused on what we can do. This one's more focused on just like some of those things that you guys were already kind of talking about, like the fact that maybe we're doing something right better than other parts of the Oregon coast, or that rates have gone down as over the the country as a whole. Like, what are some of the positive things that are already happening that we want to grow? So I think that all those ideas, hold them. You could write it on a Post-it note even if you want to, because that's what we're going to do for the next part, is try to think of ideas of what we could do. And I think smoke-free zones, I think kind of like, actually, part of what you said, Tom, I think we could include that is just like leveraging the fact that we want to be a welcoming community. Like, that's an appreciative lens. That's something that we could grow on in order to reduce the smoking in our county. Or
Like it's more comfortable to be a non-smoker than a smoker.
Yeah.
Because there's more spaces that, like, prioritizing people who.
Yeah, that culturally it already is more like in the physical space, it's more comfortable. Yeah, for sure. That's a good one too.
I think continued education on the dangers of secondhand smoke. Because secondhand smoke actually kills more people than actually being a smoker. And that is something I grew up hearing about. Like my parents had all the time.
Yeah.
So raising that awareness, because a lot of people will say, well, it's my body. If I'm killing it, and that's my choice. But it poses a real threat to people around them. So
yeah, so like capitalizing on that feeling of like, that we shouldn't be harming others that are near us, even if it is a personal choice. Yeah.
The way that high schools are set up, there's not as much. I mean, I remember it's not the same as when I was in high school.
Wasn't like a cool spot to go spend.
Yeah.
As far as I can tell.
Yeah. Yeah, there's more
parent attention and control of teenagers and teenage space.
Yeah. Yeah, that's true.
I know you guys have tobacco prevention education. I don't know like the extent that goes to like in the schools, but do you guys like go in there and teach classes or promote that at all?
Yes.
So like building off of that, I had a feeling you were, so.
Yes, yeah, we do prevention, and it's kind of ebbed and flowed. But now we have a full prevention team now. We have 2 people, and they use an evidence-based curriculum called Catch My Breath, and they just started doing that last year. They had other things they did before, but the newest thing that we're doing starting last year is this. It's the only SAMHSA recommended, which is SAMHSA stands for, I don't know if I explained it. These are if you use. So SAMHSA is the Substance Abuse Mental Health Administration. And so it's the only SAMHSA recommended evidence-based curriculum for tobacco prevention. And they talk about vaping, and it's interactive, and you can go into the classroom, and you can also, it's a teach the teachers. So we're teaching teachers how to do that also. And
We should build on that.
Okay, sounds good. Yeah, I know, I can keep talking.
Because I think like that's where it begins, is the youth.
Youth prevention.
Continue to like.
Yeah.
I also think there's like different ways that we talk about, because I remember like when I was in school, right, it was like dare was basically the only thing. And it was just like, don't do it. That's helpful. But I think the way that at least we try to talk about it now, like from how we've taught, is like, let's talk about why you started smoking. Let's talk about, some of the situational context features, and then let's figure out, if this is a means to cope with something, let's talk about other ways that you can cope with stuff. Let's talk about other activities that can serve the same function, but not with nicotine. And so I think the approach to education is also, specifically with cessation stuff, is also different. And that let's help you find other ways to meet the same need, and let's not just berate you for choosing to smoke,
Yeah,
There's
absolutely.
more of a trauma-informed care approach and use of harm reduction, which actually came out of SAMHSA.
Yeah.
Trauma-informed care came out of SAMHSA. Harm reduction came from the people of using substance. Anyway.
Yeah.
And I think too, back to the prompt about what our local culture is that kind of already promotes this. healthcare as an industry and as an occupation is so present here in our county because we have two major hospitals. We have some smaller clinics. If you're not a healthcare worker, you're accessing healthcare as a patient, or you're moving in between because we also have the community college
Yeah.
that is help training the workforce. And so at all ages and all stages, we have kind of a continuation of education and practice.
Yeah, yeah, I think that's a great one too. Yeah, we are really lucky to have, and I mean, we talk about access all the time and you know, yesterday, Dr. Duncan was talking about how there was like an antitrust case with the Supreme Court in the eighties, right, Dr. Duncan?
Here,
Yeah, here, and I mean, like how many, it was like 3/4 of the physicians left or something, or,
Well, they were bankrupt, but
yeah,
they had to leave,
yeah.
find other jobs.
And so it's like the amount of access to healthcare we have now or healthcare education that's happening in our community, like it is higher than it was in the past. And I'm really grateful for that. And I think that's something we should definitely be trying to hold on to and be watching as these Medicaid cuts happen and some of those programs are, you know, on the chopping block and getting removed that aren't like the essentials.
There does seem to be a growing intolerance for tobacco use.
Yeah.
It's not cool anymore to smoke like it used to be. Now, maybe in school it is still,
Vaping is
still,
yeah.
still find eighth graders smoking, but I don't think it's the kind of,
It's all about the aesthetic.
it doesn't have the cachet that it used to have.
Yeah.
So I don't know how you grow that, but it just does seem to be a thing that's happening.
Yeah, there's definitely ways to grow that. Peer models, that's where all the rest of them are today, is they're taking a training on a peer tobacco cessation model.
Well, it could be that before, you know, 60s and 70s, all the advertisement. It made it cool. It was great pictures of people having a great time or having a great cocktail with a cigarette. And when all those policies about not doing that, then it was not that, it's like it did not look cool anymore. Plus, it's not affordable.
Yeah.
You know, it's so expensive that that is something else. That is affordable. Yeah, I every time I see somebody smoking, I'm like, how can you afford that? It's like,
You find a way.
like cigarettes. So, but I think it just not having the advertisement. I think it not seeing those big billboards with all those great pictures, beautiful models with that cigarette that it looked very classy. I think that has helped.
Yeah,
It's not glamorized anymore.
yeah.
Isn't that
Same way alcohol consumption seems to be going down too. Kind of the same way. There's just a less of a tolerance for alcohol excess.
Yeah, I mean, I don't know, I don't have the data in front of me, but I definitely have personally been hearing more from people who are talking about like how alcohol is toxic and I'm deciding to drink less or not to drink. Or
But
I'm
alcohol and
thinking about
tobacco
it.
are linked. I mean, people smoke and drink at the same time, so decreasing in alcohol is gonna decrease the likelihood of smoking, I think, too. I mean, just they track.
They're used in very similar circumstances.
Right?
Yeah.
They're used in very similar circumstances, alcohol
Right.
and smoking.
And if you're in an environment that tolerates both,
Yeah.
you're far more likely to partake in both.
Yeah. Yeah.
I do think, because we talk about smoking, we talk a lot about cigarettes, but cigars are still very much a symbol of a gentleman, if you will. A classy individual smokes a cigar.
Yeah.
Less and less than like.
And like was having a whole debate with some males in my life. Because they came across these pictures of JFK smoking his Cuban and they're like, but he looks so cool. And he was like the greatest. Like, yeah, but like lung cancer doesn't sound like.
Well, and to the point earlier about the cost of tobacco usage,
Yeah, and cigars are
far more so for cigars versus other
Yeah.
forms of tobacco. A luxury that
Yeah.
few people can afford.
I've seen a lot of people, in part because it's a luxury, take it up recently, people who are not that much older than me, because it is kind of a symbol of
Yeah.
luxury. It's, you know, I've made it, so to speak.
Yeah, they actually, so we just went to the Tobacco or Health National Conference in Chicago last week. And I went to one session where they were talking about the advertising, and they were talking about like the documents that they've gotten from various settlements, kind of showing what the intent was behind them. And affordable luxury was like a huge market, especially for lower income women. Like they showed how they specifically targeted, they were like, let's target single mothers. And then they made some really disparaging stereotypes about single mothers. And then they decided to make their marketing around making it seem like an affordable luxury to them. It was a little bit of an escape for them. So this is why you should start using Virginia Slims. And then they showed how Jewel is doing the exact same thing on their targeting. And so it's very interesting, but that's a rabbit hole.
I do think part of like the community stuff too is it's interesting. It's like, I think part of the reason why, well, there's probably a lot of reasons, but like one of the reasons that I never started smoking is I was an athlete my whole life. And so that is highly detrimental if you want to run for a long time. And so I think there's like this community generally, I think there's a big portion of the people that really like to be outdoors and like go hiking and be healthy generally. And smoking is just fairly antithetical to that. And so I think there's an interesting kind of just general health. People being healthy, people, you know, being outside, going to the beach, going hiking, whatever that, you know, is helpful in sort of promoting more of the health side versus the side.
Absolutely. Everybody feel like we've come up with some like positive things that are already happening. We came up with some concerns also. But some positive things that we could maybe capitalize if we were going to be doing this work of trying to address perinatal.
There's also, I mean, the Peter Pan doesn't spell tobacco, and they're doing just fine. So,
yeah,
having that be more publicized, that a business can survive, like a.
Peter Pan doesn't sell anymore?
Nope.
Oh, fascinating.
No, when the new owners.
Oh, I don't know, like
It's
maybe
20. It was like during COVID, but they bought Peter Pan and they're like, no tobacco. So
the state loves them for that.
Yeah,
they've like interviewed them and
they
like
get interviewed all the time about it, but it's something like they get interviewed for the state, but not locally to be advocates for. This is a survivable thing.
Yeah, I will write that down.
Just sell lots of candy.
Something we should do.
He loves them.
Let's not highlight that
right next door. Yeah.
Give them advice for it.
They can't make much on a package of cigarettes,
Provide donuts.
and they've got to turn all that tax over to the government.
And their inventory is just things.
Right, so I don't see that's a very, that's a positive. That was pricing itself out of the market.
Retail licenses.
Also, raising the age limit of purchasing was great. Cause my brother, when he was 18, he went to go buy them and like, you can't, you're not old enough.
What's the age now?
It's 21.
Yeah.
Yeah.
Yeah. And actually, and we have a local tobacco retail license. The state has one now, but we have one since before. I'm looking at Emily because she worked for the health department. So we have one as well. And Carolina and Stephanie, they're the ones who go.
Ours is stricter than.
Yes, yeah, and ours is stricter than the states. We don't allow tobacco retailers within 1,000 feet of a school unless we're already there before the ordinance was passed. But we have told people who are applying for a license that if they decided to pay the fee and apply, we would deny them because they wouldn't qualify. So we are keeping tobacco retailers further away from schools, and 1,000 feet is like the golden standard. As far as research shows for how far kids are willing to walk, basically, to get tobacco, they aren't willing to walk the 1,000 feet. So if it's closer than that, it does mean that more kids have access. And then we also don't allow discounts. So talking about price, because they're not on billboards and they're not on TV anymore, and I don't think maybe they're in magazines. I don't read magazines. They're not really magazines anymore. Because of that, they're really focused on targeting people through mailings, and they target people who they know are at higher risk of smoking. And so they're sending out these advertisements that they know are going to homes that have youth that are focused on things that they think would make youth want to use their products. And they're sending them to people, and then that means that they're more comfortable with maybe buying or trying a new product, even if they're not underage, and then that's floating around their house. And so when price matters for youth, price matters for everyone, then those coupons and people paying more attention to those coupons and those discounts they're getting mailed, it does have an effect on. And also a lot of the advertising that Big Tobacco sends to retailers, I've noticed, this isn't like a statistical point, but they are to do with advertising discounts. And so they can't put any of those up because they can't advertise discounts. So there's less advertising. Feels like that's a personal opinion.
It'd be like when you go to Europe, then you see all the
black
cigarettes, the black lungs and all the packaging, everything is like, oh, that is disturbing. So it is something to be said about that message.
Yeah.
And now when I was traveling back from Mexico, they don't have the pictures, but all at the airport, all the cigarette boxes and cartons have like these big warnings for the health. You almost do not see the brand because it's all these big warnings about how it's going to affect. I say, oh my God, the only thing missing there is the picture because it is so big that you really don't see and every single carton of cigarettes.
Yeah.
But that is something that Mexico even does with your chips and your sodas. And everything they have, I know this is not really considered a healthy item. This is very holy. So they really put warnings on everything.
Yeah.
But it was interesting to see how big is the warning on the cartons of cigarettes at the airport. It's like, yeah, they did not mess around with that.
One thing they were talking about at the conference that made me think of the appreciative inquiry and the positive culture framework, because it didn't really fit for me, was that they were talking about the tips from a former smoker, which is the CDC campaign, where they have folks that have had, usually significant health issues because of smoking. And a lot of them have physically altered, part of their jaw, they've had to take out part of their jaw, or they're breathing through a tube, and they're kind of going through what their life looks like after having had those major health issues. And it's very shocking. And so it's a little bit, I'm like, how are they because, fear can be immobilizing is what we're learning from the positive culture framework. But they showed the statistics, and it's a very long running and very successful campaign that the CDC has put out. The number of people, like when they run the campaign in a certain area and they look at the number of people who are calling the quit line, it goes up dramatically when they run that campaign versus other campaigns. And so I think that it's worth thinking about, this is a framework, and I think that what the line is between fear and concern and the way that you communicate that, there's more than one way to do things. So I think this is a great way to think about it. But also just thinking about where that line is between fear and concern and how you communicate that. It's it's kind of a gray area.
And I would wonder, that might, the images or that campaign might help people call the number, but for people to actually continue the process of quitting, they need that they may need that positive framework to have a successful.
Yeah, and they may get that when they call. Then that's the positive part that is what keeps them going, like the motivational interviewing. Yeah. That's another positive thing, motivational interviewing existing and being used to empower people to make healthy choices. Do you guys know what motivational interviewing is? It's it's a, like an evidence-based that a lot, I mean, WIC uses it, which is the reason that I know what it is. And it's an individual one-on-one counseling technique where, and anyone else who does this or knows about it can jump in and add to what I'm saying or correct me if I say something wrong, but, and it's where you assess where the person's at, whether they are not even aware that this could be harmful to them, whether they know that it's harmful, but they're not in a place where they can really address it right now, whether they're ready to address it, but they just haven't made a plan. They've made a plan, they're ready to go. They just need some extra motivation. They're already doing it and they need some support from you that they're doing the right thing, keep going, or they've achieved their goal and they need to be, commended for having achieved that goal and to continue to maintain that. And so you assess where they're at and then you provide counseling to them based on what level they're at. You're not telling someone who didn't even know that it was an issue, all the steps that it's an issue and all the steps they need to go through to try and address it all at once. You maybe just give them the education at that point, and you hope that when they come back, maybe they've digested that and they might be ready to make a plan. So it's really effective. It's like evidence-based, and I don't think it's been around for a really long time, but I know they're using it for cessation. They're using it in WIC for nutrition and healthy life changes, and it's
a physical therapy.
It's been
Really
around
gets
for a
people
really
to
long
do
time.
things.
It's been around a really, really long time.
It's a Socratic method.
Yeah.
You ask questions in a way that it makes the person think that they thought of the answer. If you want them to get.
That's definitely part of it. Yeah. Yeah, because it's empowering them to make
That's
the
right.
choice. You're not telling
They're
them what
thinking
to
of the
do.
answer, and then
Yeah.
that's what Socrates did.
Yeah, it's true. There we go. It's been around for forever. Okay, so I'll move us on unless anybody else has some additional appreciative lens ideas. Does anyone online have ideas? Or I don't see the chat, but I know a couple people had to. Okay, but yeah, if you guys have anything, feel free. I can't see if you've had your hands raised, and we can't really see on the other device we're using. So
Can I ask a question before we pivot to the next? Norma, the local Spanish-speaking community you have any anecdotal experiences for how they have received a lot of these public awareness campaigns and maybe how their relationship with tobacco usage might differ from the rest of the community?
That is really good, and actually the way that it goes education into the Latino is actually through WIC. That is the number one thing. It is WIC. Information that you pass through WIC, it tends to go a lot further than anything else. And we've improved that with COVID times. I worked for WIC for 12 years. I was the WIC coordinator for the county. So, and that is something that when we were doing COVID, if I would call a family, the husband usually don't want to talk to me until the wife said, no, that's the WIC lady. You can talk to her. So WIC, I believe that is one of the big health pushers into the Latino community because it's a trusted source. It's somebody, it's a person there that you can trust the information. But now more and more, we are trying to really get into, and I say that because it's already trust service. We have noticed that when we try to do something with the Latino community health related, it takes us longer because they mistrust government and they mistrust anything that is being said, or they just want to get me there for something else. It's something, like last year, we tried to do something with CMH for cancer and we didn't get, and even though that I was involved, they were not. It takes a long time to get them there. So usually if we want something to be said, we filter it through WIC because I know WIC have the right amount of people. And now more and more, we have like all these private signal groups that then you can say, hey, this is happening regarding your health. This is happening regarding your health. And it is a little bit challenging now because before we could use it in our social media. This is happening. Come, join us. We're going to do this. And now everything has to be just sent through a private message. this is where we're gonna be at, because we don't want to put anybody in any kind of harm way, because you don't know who's watching.
I
And
have,
that is
I
the,
have an anecdote too for that, uh, Consejo, I think, I don't even know if I've told you this, but so we ran a campaign on, like vaping education and cessation resources for youth, and it was a bilingual, bicultural campaign. And, I forwarded all the information to Consejo and they put it on their Signal group. And then we also ran paid campaign advertisements through YouTube and we saw that the Spanish ads had a higher click-through rate. So people were watching them in Spanish, they were clicking on them more and they were going to the website. And I don't know beyond that, but it was just something you could scroll and it had, stories of youth who had decided not to use nicotine products or vape products. And it had resources and it had resources for parents. And then we're doing a youth prevention needs assessment right now. And we've heard from parents too, that like, they feel like they're not getting as much information on substance use and vaping and like, so they don't know, they feel like they don't know the base information that they would like to about what's going on and what these products do and what they are. And so I think the combination of those two things really strongly says that like Latinos want to have the information, but they don't have as much access to it. And part of it might be that they're not as willing to engage because of the fear, but also not as much stuff is in Spanish. Some stuff's only in English. And so it's just, if it's posted at school or it's just passing them by, they're not able to access that.
and by us not having like a local TV station, because we have out of Portland in Spanish, but it's giving information for the Met area, not really for here, that is gonna be completely different, because Latinos watch a lot of TV. They get a lot of the information from TV, not so much radio. But TV, you can go to a Latino home and it's always a TV on. It's always a TV. That's how they get their information, it's TV. But by not having that local really source for this area, it is only the Portland one is a little bit harder. So we have to do a little bit more of legwork to get the information. Going to the soccer games in the summer, and it's just going to the churches and keep sending stuff and keep repeating it through the direct messages. So
And
it's a little bit
heard recently this summer that KMUN is looking to get into television and community broadcasting, I think primarily through web-based, so maybe YouTube and short video over the web. And so that might be an opportunity for outreach.
Yeah, and like I said, the thing is, we don't really, like, I have a radio show once a month. And it's not like that many Latinos listen to it. Then I used to listen to a radio show, and especially at night. That's the time that they are just finishing whatever I'm going to sleep.
Yeah.
So it is harder for radio to really get that information out. But yeah, hopefully, I don't know. Pledge money is this week. Pledge money to KMUN.
Yeah.
That way they can do that for TV.
Norma, it seems like fewer Latino men smoke than the general public. Is that just a perception or is that?
Very few females smoke. It's very rare that you will see Latino women that smoke, and men are less. It used to be more. They usually prefer alcohol. Yeah, alcohol, it will say it is the choice. So much more than cigarettes.
Yeah. But youth with vaping, that's regardless of background. That's just a kind of stuff in schools. Just
A couple of things stood out to me about what you were saying, Norma, and one is just that trusted relationship. And wherever there's a trusted relationship, that's a point, whether it's the Latino community or non-Latino community, that's where people are more receptive to receiving information. And then also just to recognize, like we're talking about tobacco or nicotine use during pregnancy, and the great thing is that during pregnancy at the time when people are more likely to focus on their physical health, they're more motivated to improve their nutrition, stop their alcohol, nicotine, other substance use. And so it's like a really great Yeah, it's really,
That should have been like the biggest thing that we wrote on the arrow.
yeah, motivation is high during pregnancy.
Yeah.
And is that also coincident with more of a desire to reach out and form greater connections in the community? So more opportunities to receive information from different.
More contact
areas.
with programs like WIC that are more relationship based with doulas, with community health workers that are establishing like a more close relationship with people for sure. Like what time when people are wanting more healthcare access.
Captive audience.
Yeah.
Yeah, working with healthy families and since 2007 between WIC and Healthy Families, I work with I never ever had a Latina female that smoked. 2007 until a year and a half ago that I stopped WIC. Never had a female Latina that smoked while pregnant, or even not when they were not pregnant. I never had one.
Yeah.
So that's why I know that it's something with the culture there that they were like, no.
Yeah.
They were not into smoking and being pregnant. That was not their thing. That was Coke or Pepsi. That was a challenge. That soda thing, it was something else. You see, it's something that is more attractive to them, like having that Coca. They always say, oh, the Coca. So that was like our challenges with them. It was the soda, but never a cigarette or alcohol.
Yeah.
Is that because they look bad to themselves or because they think it's unhealthy or both?
I think
not culturally
it's not
acceptable.
culturally pushed or accepted or even they didn't have the money, like I said again.
Well,
They don't have the money to buy it when they were growing up and it's something, but that Coca, that is like, we all have a challenge and for Latinos, it's that Coca-Cola. And they'll tell you, oh, it's that Coca Fria. You know, that cold Coke is what they really want. So, you know, it is another thing that it's not like they are like, oh, we are so healthy. We don't, no, we have our own things, but it's interesting that that's where the focus was in a soda, not on a cigarette or alcohol or a pregnant female. So.
Okay, so for the next one, I feel like we've already kind of, because I do this too. Like, I just want to jump into solving the problem. And so we kind of started doing that with the last one too. So for this one, I drew a very pretty picture that looks just like this one on the back wall there. And it's talking about the social ecological model, starting with individuals. So that's knowledge, attitudes, skills, behavior, moving up to interpersonal, which is friends, family, social networks, institutional, organizations, schools, workplaces, and then talking about cities, neighborhoods, resources, and norms. And then the final one that they don't have in the model, but I think is really important, is policy. So that's federal, state, and local legislation. So, you know, we talked about smoke-free areas. You know, we mentioned in there. And we talked about a lot of other stuff too, that I think would be a great Post-it note. So if you're thinking of something that you kind of started to drift into during this, or talking about these norms that you thought of that would be something we could do, then write it on a Post-it note and go put it on one of those places. And we'll spend about 10 minutes doing this. We're kind of coming up on the end, and we had a really great conversation, but maybe we'll just spend 5 minutes doing this because I want to leave time for us to give updates. And then we'll look at that and then we'll move on to takeaways and any sort of community. Thanks, Tom.
Read it.
I'll go over and read them. Hopefully I can read people's handwriting. I'm not always the best.
My handwriting's off.
What are we supposed to put down? Things in these different circles that
Ideas for how to,
are.
like what might, so write on a sticky note and put on the board, what might we do?
In addition to what's already done.
Yeah, or that we want to expand on. It could be too, like I should probably write on one, like expanded prevention, you know? And, or like, you know, stricter tobacco retail license laws that for the whole state include 1,000 feet away from a school and no discounts. No flavors would be a huge one for everybody, but especially for youth.
Somebody writing down what these was saying.
We
only have a couple minutes. So
we don't have to, I mean, we don't have to do this whole thing. I think Tom's on fire. He's got ideas. He's writing stuff down, but. So.
Tommy's invested.
Yeah. So we've got more tobacco-free zones and policy. Those would be policies that could be passed on citywide. They could be passed on, you know, we do have some for statewide. We have the, what's ICA stand for? That's federal, but people can't be smoking within 10 feet of an entrance that's open to the public. You can make a complaint about it, about people's.
So for policy, idea I had no renewal of licensing or no sales of legacy businesses to new business owners. Just say, okay, that's the end of this.
Yeah. Well, and Warrenton's one that they passed recently saying that they have basically an exclusion zone in their downtown where they don't want people to be smoke shops or tobacco retailers. They have a percent, if you're selling more than this percentage of your sales are around tobacco, then you're a tobacco shop, and we don't necessarily want you to be on our main street. We want other types of businesses there. So there's lots of policy options and fitness subsidies. Yeah, like just focusing on overall health. And that was something they talked about at this conference too, was if you help people and lead people to health, then they're going to start questioning their tobacco use. And so, and anything that we can do that's going to help, and that can be on a community level and institutional level too, like talking about what things WIC does, what things is WIC doing. WIC is like a really important touch point, which is why we created this.
I'm thinking of an idea, which is making this free cessation resources much more accessible and available to pregnant people, figuring out like I don't think I have it on the resource directory.
Yeah.
And like figuring out where else that could be, that information, making that very accessible.
Yeah, totally. I mean, yeah, I talk to people, organizations all the time, and they're like, oh yeah, I should get some tobacco quit line cards. You know, it's like, and CMH has a tobacco cessation person. I think they might be like the only person really for our county, and then people can call the number too. But people, that's not really well-known resources. So just increasing knowledge of resources and not being given out at touch points and institutions.
Is she full-time again?
Yes.
So I put on institutional for our schools, our workplaces, and other buildings. Since 2020, with the big wildfires, a lot of them have gotten HVAC upgrades to provide clean air for both smoke and for public health. Identify that this indoor space is a clean air space or shelter, and so just discouraging anything that would impact that for any variety of reasons that people might need improved air quality.
Yeah. Well, and the county, they have a 50-foot, it's not 10 feet for them, within 50 feet of their entrances, they have a policy, an institutional policy that you're not allowed to smoke. And so that, like, thinking about what places perinatal people are accessing and trying to, you know, encourage those institutions to have even larger areas of smoke-free around and within their businesses. And then welcoming image supportive efforts beyond public health for the community. Yeah, like being welcome, us leveraging that, like we could talk to the Chamber of Commerce about that, or the tourism board, or the different associations about wanting to have, you know, welcoming space, and how do we create those smoke-free, or what can we do to create that? And then the encouraging sensation, motivation, fitness, gym, fitness, family. Yeah, so in your family, creating that culture and helping families know how to create that culture of health within their family. And starting in the perinatal period is like the best time to start, because that's when they're just starting to think about what they want that to look like for their family. And then individual, we talked about motivational interviewing, and I think there's lots of like the technique that they're doing right now, where they're learning how to do this like peer model of support, and there's lots of really great evidence-based options that people could use for individuals, and that we could be trying to promote organizations to use. So, yeah, okay. Did that? Oh, go ahead.
I'd say it kind of interlinks with most of them that would have mothers with pregnant people and their families interacting with some sort of representative. You're gonna have to have racial diversity, because I mean, like for Black women, they still don't get the medical care that like you and I would get.
Yeah.
And a lot of them are now actually, like, you're seeing a big spike in them choosing Heptola and not going to hospitals.
Yeah.
Because medical schools still teach this myth that Black people can endure more pain, that their bodies are more resilient to illnesses, they don't get the care they need. So they're very rightfully so and understandably hesitant to accept help from such organizations. So you're gonna have to have people who look like them and who come from, you know, similar backgrounds approaching them, or that it's never gonna really work.
Yeah, and I took that at the institutional, community and policy levels for sure, because, you know, like institutionally, if you don't have a diverse workforce, then your organization is not resilient and can't serve the entire community. And so having policies in place within your organization to encourage that kind of diversity in your workforce, so that you can have those that knowledge and that lens when you're creating other policies and creating processes to serve the community in a trauma-informed and way that's relevant to them. And then for community as well, and policy, I mean, systemic racism goes through all of those levels. And thank you. Okay. So I'm not going to pause here for very long, but just you can think about how this could apply to your work. I mean, if you're doing any sort of campaign or you're trying to grow any sort of program, you could use this lens or part of it. You could use parts of it with the appreciative lens and the communication piece for how you want to build your communication in your initiative. If you're trying to kind of get more support from the community and momentum, then you could use the coalition building piece. And then the appreciative lens is, I mean, I think we should just try to use that for everything. It's really hard to have that appreciative lens sometimes. And so raising that concern, but also seeing what good is happening and capitalizing on that, I think is, for me, a lot more of a emotionally sustainable place to be doing my work from. And so I found that it's really resonated with me, and I hope that you guys can think of ways that it would resonate with your work that you're doing as well. And then this slide, I'm going to send these out also, but this just has a link to the manual, and they also do actual trainings from Montana State University. So then just moving into kind of chart in general. Right now, we are at this spot right here for September. It's the workshop meeting. So we're rotating every month. Next month will be a networking meeting. We're going to kind of try to do like a speed dating version of networking, so that we all get to know what each other's programs are a little bit better, and form some personal connections with people at other organizations. So if we have a question or something, we know who to email. So bring your business cards with you. And then, oops, I shouldn't have.
That, Lisa?
That is
October start on a Wednesday?
It's October 8th. Yeah, October starts on a Wednesday. So not the 1st, but the 8th. So it'll be October 8th at 9:30 here. And then after that, in November, Kayla's going to do a Data 101 presentation, which I'm really excited about learning more about data. And then in December, we are going to do our retreat in December again this year. We tried doing it in January last year, and I think it went fine, but I think that people gave us feedback that they kind of preferred December more. So we're going to do our retreat in December. It'll be on the same day, the second Wednesday, but it will go longer. We usually do like a half day. And that's really an opportunity for us to like look at the year in review, think of what we liked, what we didn't like, what we really want to do, and figure out what to do for the next year. We'll also be reviewing the ripple effect mapping that we did to kind of help us find those themes of commonality. And that's it for my presentation. And now we can go around and we can share updates. Oh, and then I also put materials. It's Suicide Prevention Month. And since we're talking about tobacco, I put materials on the back for both those things. You can take whatever you might want to take back. And you can also order them for free from the organizations that gave them to us.
Also, there is a sign-in chart on that
Oh,
table.
thank you.
So if you didn't sign in when you first got in here, if you could do that, that would be good.
Do you want to start?
Yes. Like, I got organized. I was planning on getting organized when I got here, but in October, we have Spanish language doula trainers or training happening. And that's going to be online, and there's 10 scholarships for the 3 counties, an additional 3 for Tillamook County. And yes, so I have flyers for that, and I'm going to send some of them with you to hand out in Tillamook. But if you want those, I have those. I also have some of our perinatal resource handouts, which are also downloadable from the website. So, and I have a baby blues connection handout over here. So I have a bunch of materials, but the main thing is like really getting the word out about the Spanish language doula training, and we are getting a big response, and maybe like a third of the people, I think I'm almost up to 20 people who've responded that they're interested.
Oh my God.
About a third are from the Portland area, and so I'm gonna have to work that out, but there's huge interest, huge need, so that's exciting. Yeah.
I just have two things from the co-ed. So we are having our monthly community meeting tomorrow in Seaside. For those who don't know, we are trying to stand up with the emergency management department, a really sort of community-based network of organizations. So organizations like everyone here, but also businesses and maybe religious groups that could create a network to basically come together in the event of a disaster and be a part of recovery efforts. And so what we've been doing is we've been going around to various areas in the county just to meet with local people and talk about challenges, but also opportunities that might be present in their community to be able to respond in a disaster. And so tomorrow we are meeting in Seaside. Everyone is welcome. We look for people in the community, but everyone is welcome to come. So that's 3 to 5 tomorrow at the Seaside Methodist Church. And then we are also partnering with the Red Cross this weekend in Cannon Beach to offer a training around how to, if you're ever interested in how to set up, manage, and then shut down a shelter in a disaster. So this would not require like a commitment that you would be a volunteer, but it's more just like starting to understand what it would be like to manage a shelter during a disaster. So the Red Cross is putting that on. It's Saturday, 9:30 to 11:30 at the community church in Cannon Beach. So if you guys want to register, we have an email address of the woman of the Red Cross to register. So if you have people or anyone that's interested in going, please let me know. We can pass it up.
I would say in the veteran world, Clatsop Community Action recently acquired more funding for the veteran-specific housing assistance program. So if you know any veterans in the county that are at risk or experiencing homelessness, please send them to Clatsop Community Action. And in the other court, I would say we do have our second veteran stand down / convention that I'm putting together, hopefully before I take off for parental leave. I think is what it's called. But anyway, so that's going on. And if you're interested in attending, I'm going to be soliciting everyone that attended last year. But if you would like to come out, please let me know. I will bring business cards next time. Or you can reach out to anyone at CCA and tell them that you'd like to speak with Sam.
Last year I forgot,
Yeah.
I like added a period to your email or something, and like,
Oh.
I was like, I can't keep up with it. All me. Okay, I don't have too many updates. I'm just gonna put a plug in for the Clatsop partnership meeting that we're still hosting every fourth Thursday of the month outside of the in-person meetings that the Bob team holds, which will be next month. So Bob team in-person meeting, September 16th, 10:30 to 12 in Astoria. You want to bring some flyers down there? That's what might be a good idea. I won't be at that meeting, but, and if you know anyone in Tillamook that might be interested in attending, a 2-on-1 roundtable, I'll just put that plug in too. That's gonna be next Tuesday. You can email me for info. Lunch provided. And I think that's it.
And, from State OEM, September is National Preparedness Month, so at all ages and all stages, I challenge everybody to try to learn something new this month and look for somebody in your household or your workplace to also learn with you. So that can be as simple as teaching somebody how to fire up the generator at home if you have a generator. You don't need to start a fire, but taking out your fire extinguisher and practicing the steps to use it at home or work if you needed to. Or simply imagining if I had to leave school or work or wherever I am right now, where is a safe place I know I could go? And if there's somebody that I hope would be there to help me, do they know that they're my safe spot and my safe person that I'm coming to? In case something bad happens, they should expect me to be on my way. And that's my update for this month.
I don't really have any updates. I think we aren't doing anything new, are we?
We're doing tons of new stuff, but not enough time, not enough time.
I think we're continuing the old.
We're going to the Veterans Stand Down event. We're going to the COAD. I'm really excited about the doula thing. I think that we put it in the, I think we put it in the little newsletter for, that I sent out earlier this week. But if you could email, do you have Ariel's email? Could you email her the link she asked?
She's in the chat.
Yeah.
Yeah.
Yeah, and then she also asked for Sam's email because Ariel would love to connect with you. So I don't know what your email address is, but
I'll put it on a sticky note, give it.
okay, thank you.
Anyone else who wants me.
Yeah.
So SNAP Ed will be sunsetted as of September 30th, but that doesn't mean that OSU Extension still isn't going to be continuing to do nutrition and physical activity education, as well as all the other health promotion education that we do. I will continue to be that person, but I will be in 3 counties instead of just. SNAP Ed, unfortunately, was a part of the Farm Bills cuts.
Is Food Hero still existing? Okay.
So Food Hero won't have any new updates for a while. It's kind of a lot of the stuff that we do is going to be put on pause while we reorganize and figure out what's happening now with only a quarter of the people that we had before, the quarter of the funding. But Food Hero, that wonderful site, and all the recipes will still be able to be used and accessed. I have tons of Food Hero monthlies in my office if you want to come in.
Yes.
Or if you're like, I wonder about apples, give me a call and I might have 500 flyers about apples. So don't be afraid to call and ask, is there Food Hero about this? And yes, sure, come over to my office and I'll give it to you. Or someone else in my office, they know where the Food Hero is and they will give it to you. But yes, the Food Hero website will continue to exist. As I said, we're putting things on pause, like our virtual courses and things like that. That's all
So
good.
there might not be a new highlight.
Correct.
Or we can still go in.
Yep, there won't be any new blog posts as of September 30th. But we're hoping that we can do new things. It's gonna be new and exciting and adventurous. And if I look off into space, that's fine. I'm doing it.
Consejo is going to have, the chamber is going to be there on Thursday night. If you want to go and visit Casa Mariposa from 5:30 to 7, 565 12th Street, the best entrance to the parking lot in the back. You can go and see our big mess. And on October 11th, together with First Lutheran Church, we're gonna have like a painting party. So if you are inclined that you have nothing to do on October 11th, come join us. And we will give you a brush and you can help us paint that humongous building and inside. And also, this year, we are going to do again Magia Navideña. Magia Navideña, it was a program that we did last year to get presents for Latino kids. We actually covered 283 kids last year in 4 different counties. So let me know if you will be interested again. And it is super fun. And we celebrate that with an event called Cerveza y Chocolate in the beginning of December. And that's when you bring the presents and we give you beer and chocolate stuff, all kind of chocolate items. And we play loteria, Mexican loteria, which it was so much fun last year that I didn't know it almost became like an extreme sport. We wanted to do that. So also we're gonna have at the end of this month, the last Tuesday is gonna be for George benefit of the month is gonna be Consejo Hispano. This year, we are not going to have public events like we done before for Hispanic Heritage Month. That is something that it's very painful that we're not doing it. But we really are trying to keep our community safe. And it could be that it may seem as overcautious, and I don't mind being overcautious for everything that I see that is happening on the state. So we will not be celebrating very openly this year. We started already having some proclamations in Seaside, and we will have a story in the beginning of October, and at the couple of weeks will be for the county. But we still celebrate it, even though that it should not be only 1 month that we could celebrate a Latino heritage, but it should be every day, like everybody else, right? But yeah, just let us know any information that you want to know about our programs. We're going to start our after school program for Latinos in the 24th, I believe, or 23rd. People need to register in person. It's going to be 3 days a week. And it's very cultural oriented and guided, and it's about language and culture and all things Latino for Latino.
That's pretty cool. That is something in our focus groups that parents talked about, was wanting, they felt like their kids were spending a lot of time alone at home after school, and they really wanted things for them to do to engage in a meaningful way.
Here we go.
The empowering women, I've seen that like you guys are doing it in Tillamook still for sure. Are you guys still doing it in Clatsop County?
Yeah, we do it on Seaside. It's been imposed in August and September just because vacations.
Okay, so that was just a pause.
Yeah, it was just a pause because vacation, but we just started now. We started last week in Tillamook on Thursdays, and we usually have it on Seaside on Thursdays. On Astoria is on Tuesdays, but that one is also being everything until all vacations.
Okay, so those are just pauses.
It's just pause for vacations, but not the programs, and that is the best way for anybody who wants to do a presentation about a program. That is a good way to do it. I can get you in touch with Guadalupe Beltran. She runs the women's empowering groups, and that is the best way for people to go and talk about certain things. And you will have like an hour that you can talk to these women, and that information that gets distributed into the community.
Yeah, it seems like an awesome. Okay. Yeah, we're a little over time. Thank you for those of you who have patiently stayed the 5 minutes extra so far. So I also have, we're going to be at the Aging Well Health Fair. So I have some of those which is it's in Seaside at the Bob Chisholm Center on Monday, September 22nd. And then I think somebody mentioned the McKinney-Vento program for student assistance. And so it's in Spanish and English. The Aging Well is only in English, but so if you want to take any of those, if you know any students, you're welcome to take these two. I'll put them on the back. But yeah, browse the 988 stuff and the tobacco stuff.
From the online?
Oh, no, there was the one, actually. Thank you. Meredith had to jump off, but she said that if anyone wants to table at our new student resource fair at CCC on Tuesday next week, to shoot her an email. And I can.
Tom also wanted to put out his.
Oh, yeah. And then Tom also was talking about on September 17th, how he has and on through November 19th, they're going to be facilitating a Nurturing Fathers online free course, which is really awesome. I'm definitely going to share that with Wick. So if anyone wants more info about those things, then
Like info.
oh, why is it still just showing that? The wellness fair?
Yeah.
Okay, I will, yes, yeah, I'll make sure to email that to Ariel because I don't have that on my computer. So, yeah, but if anyone else wants info about that, stop by and I can write it down on a Post-it for you, since some of those things are coming up. I don't know why I can't get it to.
You said the CCC was on Wednesday?
The news.
It's on Tuesday.
It's Tuesday.
Which included your email.
Okay, doesn't matter. This is where, there we go. Okay, that's showing now. So it's just Ariel and us left because everybody else had to go. But yeah, if you guys want any more information on some of the stuff that was in the chat, like the fathers or the stuff from Meredith, then let me know and I can write down their emails for you. And I think that is it. The next meeting is Wednesday, October 8th. It will be a speed dating networking meeting. So anything else from anyone? All right. Thank you so much for coming.
Thank you. I want to pass this on.
Thank you, Ariel. I'll send you an email with the Aging Well fair information.
Yeah, okay, I thought it was a.
And Kestrel's gonna send her the doula training link, so I think we're good.